Hi, I'm Mark Johnson, your educator at YNS. Today's session covers a new set of NCLEX practice questions using our partner platform, Exam ASAP. This innovative AI-powered question bank adjusts to your performance and provides audio rationales for a unique and efficient review process. For full access, please refer to the description box below. Have your notebook ready and follow along as we sharpen your critical thinking skills. Let's get started with question 1.
A 65-year-old client with advanced lung cancer is admitted to the oncology unit. The client expresses feelings of hopelessness and mentions, "I don't see the point in continuing treatment." The nurse notes that the client has been refusing meals and isolating from family visits. What is the most appropriate nursing intervention to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to join a cancer support group. Option 2. Discuss the benefits of continuing treatment with the client. Option 3. Arrange for a consultation with a mental health professional. Option 4. Provide nutritional supplements to improve the client's appetite. The correct answer is C. Rationale. Correct answer, the third option. Arranging for a consultation with a mental health professional is the most appropriate intervention. The client's expressions of hopelessness and withdrawal are indicative of potential depression or anxiety, which require professional assessment and intervention. A mental health professional can provide therapeutic support and explore the client's feelings and thoughts about their illness and treatment. This approach addresses the client's psychosocial needs directly and can help improve their overall well-being. Distractor rationales. A. The first option. While support groups can be beneficial, the client's current state of hopelessness and isolation may require more immediate and individualized intervention. B. The second option. Discussing treatment benefits may not address the underlying emotional distress and could be perceived as dismissive of the client's feelings. D. The fourth option. Providing nutritional supplements addresses physical needs but does not directly address the client's psychosocial distress. Clinical tip. When a client expresses feelings of hopelessness, it's crucial to assess for depression and involve mental health professionals early to provide comprehensive care. A 55-year-old client with a history of chronic NSAID use presents to the emergency department with epigastric pain and black tarry stools. What is the nurse's priority action? Here are the options. Option 1. Administer omeprazole. Option 2. Prepare the client for endoscopy. Option 3. Check the client's hemoglobin level. Option 4. Insert a nasogastric tube. The correct answer is C. Rationale. Correct answer, the third option. Checking the client's hemoglobin level is a priority because black, tarry stools suggest gastrointestinal bleeding, which can lead to anemia. Assessing hemoglobin will help evaluate the severity of blood loss. Administering omeprazole, the first option, may reduce acid production but does not address acute blood loss. Preparing for endoscopy, the second option, is important but not the immediate priority. Inserting a nasogastric tube, the fourth option, may be indicated for decompression, but is not the priority action before assessing blood loss. Distractor rationales. A. The first option. This option is incorrect because administering omeprazole addresses acid reduction, but not the immediate issue of potential bleeding. B. The second option. This option is incorrect because preparing for endoscopy is important for diagnosis, but not the immediate priority action. D. The fourth option. This option is incorrect because inserting a nasogastric tube addresses decompression rather than assessing hemodynamic status. Clinical tip. Always assess for signs of bleeding in clients with peptic ulcer disease who present with melena or hematemesis. After a child's intussusception diagnosis, the parent is anxious. What is the best nursing intervention? Here are the options. Option 1. Provide detailed surgical information immediately. Option 2. Offer empathetic listening and validate feelings. Option 3. Encourage discussion with the surgeon. Option 4. Suggest joining a support group. The correct answer is 2. Rationale. Correct answer 2. Offering empathetic listening and validating the client feelings is crucial in supporting the client coping mechanism during this stressful time. Acknowledging the client emotions helps build trust and allows them to express feelings without fear of judgment, which is essential for therapeutic communication. This approach helps to alleviate anxiety and provides the client with a sense of stability and support during a crisis situation. The intervention demonstrates compassionate nursing care that addresses immediate emotional needs while fostering a therapeutic relationship. Distractor rationales. Number 1. Providing detailed surgical information immediately may overwhelm the client and does not address their immediate emotional needs or current state of anxiety. 2. 3. While encouraging discussion with the surgeon is valuable for medical information, it may not immediately address the emotional support necessary at this critical moment. 4. Suggesting a support group is beneficial for long-term coping, but does not provide the immediate emotional support and validation needed in this acute situation. Clinical tip. In crisis situations involving pediatric patients, prioritize emotional support for parents through active listening and validation of feelings to help them process distressing news and maintain their ability to make informed decisions. The 10-year-old child with attention deficit hyperactivity disorder, ADHD, is admitted to the pediatric unit for observation after a fall at school. The child is impulsive and has difficulty following instructions. Which nursing intervention is most important to ensure the child's safety during hospitalization? Here are the options. Option 1. Place the child in a room with another child for companionship. Option 2. Provide the child with a structured daily schedule. Option 3. Ensure the child's room is free of clutter and hazards. Option 4. Encourage the child to participate in group activities. The correct answer is 3. Rationale. Correct answer, the third option. Ensuring the child's room is free of clutter and hazards is crucial for safety, especially for a child with ADHD who may act impulsively. This intervention directly addresses the risk of injury by minimizing environmental hazards. Children with ADHD may not be aware of potential dangers, making it essential to create a safe environment. While structure and social interaction are important, the immediate priority is to prevent accidents by removing physical risks. Distractor rationales. A. The first option. While companionship can be beneficial, it does not directly address safety concerns related to impulsivity and environmental hazards. B. The second option. A structured schedule is helpful for managing ADHD, but it does not directly prevent physical injuries. D. The fourth option. Group activities can be beneficial for social skills, but they do not address immediate safety concerns in the child's environment. Clinical tip. Always assess the environment for potential hazards, especially for patients with conditions that affect impulse control or awareness of safety. An 82-year-old client with osteoporosis is admitted to the hospital after a fall at home. The client is on a calcium supplement and has a history of hypertension. The provider has ordered bed rest for 48 hours. Which nursing intervention is most important to ensure the client's safety during this period? Here are the options. Option 1. Ensure the client has a bedside commode. Option 2. Place a fall risk bracelet on the client. Option 3. Implement a turning schedule every 2 hours. Option 4. Encourage the client to ambulate with assistance. The correct answer is C. Rationale, correct answer, the third option. Implementing a turning schedule every 2 hours is crucial for a client on bed rest to prevent pressure ulcers, especially in an elderly client with osteoporosis who is at increased risk for skin breakdown. This intervention addresses both safety and skin integrity, which are critical in this scenario. While other options are important, preventing pressure ulcers is a priority due to the client's immobility and fragile skin. Distractor rationales. A. The first option. While a bedside commode can prevent falls, the client is on bed rest, making this option less relevant. B. The second option. A fall risk bracelet is important, but does not directly address the immediate risk of pressure ulcers. D. The fourth option. Encouraging ambulation contradicts the provider's order for bed rest and could increase the risk of injury. Clinical tip. For clients on prolonged bed rest, regular repositioning is essential to prevent pressure ulcers and maintain skin integrity. A 32-year-old client with a history of inflammatory bowel disease, IBD, is admitted to the hospital for a severe flare-up. The client expresses feelings of frustration and hopelessness due to the chronic nature of the disease and its impact on their quality of life. As the nurse, what is the most appropriate initial intervention to address the client's psychosocial needs? Here are the options. Option 1. Acknowledge the client's feelings and encourage them to express their emotions. Option 2. Suggest the client join a support group for individuals with chronic illnesses. Option 3. Provide educational materials about IBD management strategies. Option 4. Discuss the potential benefits of medication adjustments with the healthcare provider. The correct answer is A. Rationale. Correct answer, the first option. Acknowledge the client's feelings and encourage them to express their emotions. This intervention is crucial as it validates the client's experience and provides a safe space for them to express their emotions, which is a fundamental aspect of psychosocial care. It helps build trust and rapport, allowing the nurse to better understand the client's mental health needs. Addressing emotional distress is a priority before suggesting other interventions like support groups or educational materials, which can be introduced once the client feels heard and supported. Distractor rationales. B. The second option. While joining a support group can be beneficial, it is not the initial step. The client needs immediate emotional support from the nurse before considering external resources. C. The third option. Providing educational materials is important, but it does not directly address the client's current emotional distress and feelings of hopelessness. D. The fourth option. Discussing medication adjustments is a medical intervention and does not directly address the client's psychosocial needs at this moment. Clinical tip. When dealing with clients experiencing chronic illness, always prioritize acknowledging and validating their emotions to foster a therapeutic relationship and address psychosocial needs effectively. A 45-year-old client with newly diagnosed hypothyroidism is experiencing symptoms of depression, including low energy, lack of motivation, and feelings of hopelessness. The client is struggling to cope with these changes and is concerned about their impact on daily life. As the nurse, what is the most appropriate initial intervention to support this client's psychosocial integrity? Here are the options. Option 1. Encourage the client to join a support group for individuals with thyroid disorders. Option 2. Suggest the client increase physical activity to boost mood. Option 3. Refer the client to a mental health professional for counseling. Option 4. Provide educational materials about hypothyroidism and its effects on mood. The correct answer is C. Rationale. Correct answer, the third option. Referring the client to a mental health professional for counseling is the most appropriate initial intervention. This approach addresses the client's depressive symptoms and provides professional support to help them develop coping strategies. Counseling can help the client understand the connection between hypothyroidism and mood changes and offer therapeutic interventions to manage depression. Early intervention by a mental health professional can prevent worsening of symptoms and improve the client's overall quality of life. Distractor rationales. A, the first option. While support groups can be beneficial, they are not the initial intervention for managing acute depressive symptoms. B, the second option. Increasing physical activity can help improve mood, but it may not be feasible for a client with low energy and motivation. D, the fourth option. Providing educational materials is important, but it does not directly address the client's immediate psychosocial needs. Clinical tip. When clients present with mood changes related to medical conditions, early referral to mental health services can be crucial in providing comprehensive care and improving outcomes. The 65-year-old female client presents to the clinic with complaints of bone pain and muscle weakness. She reports a history of limited sun exposure and a diet low in dairy products. Which health promotion strategy should the nurse prioritize to address the client's risk for osteomalacia? Here are the options. Option 1. Encourage a diet high in vitamin D and calcium. Option 2. Recommend daily weight-bearing exercises. Option 3. Advise on the use of sunscreen to prevent skin cancer. Option 4. Suggest regular bone density screenings. The correct answer is A. Rationale. Correct answer, the first option. Encouraging a diet high in vitamin D and calcium is crucial for preventing osteomalacia, especially in individuals with limited sun exposure and low dietary intake of these nutrients. Vitamin D is essential for calcium absorption, and both are critical for bone health. This strategy directly addresses the underlying nutritional deficiency contributing to osteomalacia. While exercise and screenings are important, they do not directly correct the nutritional deficits causing the condition. Distractor rationales. B, the second option. While weight-bearing exercises are beneficial for bone health, they do not address the nutritional deficiencies causing osteomalacia. C, the third option. Sunscreen use is important for skin cancer prevention, but does not contribute to vitamin D synthesis, which is needed for bone health. The fourth option. Bone density screenings are useful for diagnosing osteoporosis, but do not prevent or treat osteomalacia. Clinical tip. For older adults, especially those with limited sun exposure, ensure adequate intake of vitamin D and calcium through diet or supplements to prevent osteomalacia. A 68-year-old client with a history of bronchiectasis presents to the respiratory clinic for a follow-up appointment. The client reports increased sputum production and chronic cough. What primary nursing intervention should be included in a client's basic care plan to help manage these symptoms? Here are the options. Option 1. Teach the client pursed-lip breathing techniques. Option 2. Encourage the client to engage in daily aerobic exercise. Option 3. Instruct the client on postural drainage and chest percussion. Option 4. Advise the client to increase fluid intake to 3 liters per day. The correct answer is C. Rationale. Correct answer, the third option. Postural drainage and chest percussion are essential techniques for managing bronchiectasis by helping to clear secretions from the lungs. This intervention promotes better airway clearance, reducing the risk of infection, and helping to alleviate symptoms like chronic cough and increased sputum production. These techniques are particularly effective because bronchiectasis leads to abnormal widening of the bronchi, resulting in mucus accumulation. By facilitating mucus expulsion, postural drainage and percussion improve breathing and reduce discomfort. Distractor rationales. A. The first option. While pursed lip breathing is beneficial for controlling breathing and prolonging exhalation, it does not directly address the removal of excess sputum in bronchiectasis. B. The second option. Regular exercise is important for overall health, but does not specifically aid in mucus clearance in bronchiectasis. D. The fourth option. Although adequate hydration is important, simply increasing fluid intake does not specifically target the management of excess sputum in bronchiectasis. Clinical tip. For bronchiectasis, incorporating airway clearance techniques like chest physiotherapy into daily care can significantly improve quality of life by reducing mucus accumulation. A 45-year-old client with a history of cholelithiasis is admitted to the hospital for severe abdominal pain and jaundice. The nurse notes the client is scheduled for an ERCP, endoscopic retrograde cholangiopancreatography, later today. Which nursing action is the highest priority to ensure a safe and effective care environment? Here are the options. Option 1. Ensure the client has signed the informed consent form. Option 2. Administer the prescribed pre-procedure antibiotics. Option 3. Verify the client has been NPO for at least 8 hours. Option 4. Check the client's allergy status and document it. The correct answer is C. Rationale. Correct answer, the third option. Ensuring the client has been NPO, nothing by mouth, for at least 8 hours is crucial for the safety of the ERCP procedure. This reduces the risk of aspiration during the procedure, which is a significant concern in endoscopic procedures involving sedation. While informed consent and allergy status are important, they do not directly impact the immediate safety of the procedure like NPO status does. Administering antibiotics is also important, but not as time-sensitive as verifying NPO status. Distractor rationales. A. The first option. While informed consent is legally required, it does not directly impact the immediate safety of the procedure. B. The second option. Administering antibiotics is important for infection control, but is not as time-sensitive as ensuring NPO status. D. The fourth option. Checking allergy status is crucial for preventing allergic reactions, but ensuring NPO status is more critical for immediate procedural safety. Clinical tip. Before any procedure requiring sedation, always verify NPO status to prevent aspiration, which is a life-threatening complication. A 7-year-old child with newly diagnosed acute lymphoblastic leukemia, ALL, is beginning chemotherapy. The parents express concern about their child's growth and development during treatment. Which nursing intervention is most appropriate to support the child's growth and development during this time? Here are the options. Option 1. Encourage the child to participate in age-appropriate physical activities as tolerated. Option 2. Advise the parents to focus solely on academic achievements during treatment. Option 3. Suggest the child be homeschooled to avoid exposure to infections. Option 4. Recommend limiting social interactions to reduce stress and fatigue. The correct answer is A. Rationale. Correct answer, the first option. Encouraging the child to participate in age-appropriate physical activities as tolerated is crucial for maintaining physical development and providing a sense of normalcy. Physical activity can help improve mood, reduce fatigue, and support overall well-being, which is important for growth and development. It also allows the child to engage in social interactions, which are vital for emotional and social development. This approach balances the need for rest with the benefits of activity, promoting holistic health during treatment. Distractor rationales. B. The second option. Focusing solely on academic achievements can neglect other aspects of development, such as social and physical growth, which are equally important. C. The third option. While infection prevention is important, homeschooling may isolate the child and limit social development opportunities. D. The fourth option. Limiting social interactions can hinder social development and emotional well-being, which are critical during this stage of growth. Clinical tip: incorporate play and physical activities into the daily routine of children undergoing treatment to support their growth and development, while also considering their energy levels and treatment side effects. A 67-year-old client has been diagnosed with postoperative ileus following an abdominal surgery. The nurse is developing a care plan to manage the client's condition and promote recovery. Which intervention should the nurse prioritize to address the client's ileus? Here are the options. Option 1, administering prescribed oral laxatives. Option 2, encouraging early ambulation. Option 3, providing a high-fiber diet. Option 4, increasing oral fluid intake. The correct answer is B. Rationale, correct answer, the second option. Encouraging early ambulation is a key intervention in managing postoperative ileus. Mobilization helps stimulate gastrointestinal motility by increasing blood flow and activating the parasympathetic nervous system, which facilitates peristalsis. This decreases the duration of ileus and promotes the return of normal bowel function. Initiating early ambulation is an effective, non-invasive strategy to enhance recovery and prevent complications associated with ileus. Distractor rationales. A, the first option. Administering oral laxatives is inappropriate as they may exacerbate discomfort and do not address the underlying lack of peristalsis in ileus. C, the third option. A high-fiber diet is not recommended during ileus, as it can worsen symptoms and is generally inappropriate until bowel function returns. The fourth option, increasing oral fluid intake, is beneficial for hydration, but does not directly address the lack of bowel motility in ileus. Clinical tip: encourage postoperative clients to engage in light ambulation as soon as feasible to promote recovery and prevent complications like ileus. A 45-year-old client with hyperaldosteronism is admitted to the hospital for management of hypertension and electrolyte imbalances. The client expresses feelings of frustration and anxiety about their condition, stating, "I feel like I'm losing control over my life." Which nursing intervention should the nurse prioritize to address the client's psychosocial needs? Here are the options. Option 1, acknowledge the client's feelings and provide emotional support. Option 2, educate the client about dietary modifications to manage hypertension. Option 3, administer prescribed antihypertensive medication promptly. Option 4, encourage the client to participate in a support group for chronic illness. The correct answer is A. Rationale, correct answer, the first option. Acknowledging the client's feelings and providing emotional support is crucial in addressing their psychosocial needs. This intervention helps validate the client's emotions, reduces anxiety, and builds a therapeutic relationship. It is essential to prioritize emotional support in clients experiencing a sense of loss of control due to chronic conditions like hyperaldosteronism. While other interventions are important for physical health, addressing the client's immediate emotional distress takes precedence in this scenario. Distractor rationales. B, the second option. While educating the client about dietary modifications is important, it does not directly address the client's immediate emotional distress. C, the third option. Administering antihypertensive medication is necessary for managing physical symptoms, but does not address the client's psychosocial concerns. D, the fourth option. Encouraging participation in a support group is beneficial long-term, but does not provide immediate emotional support. Clinical tip: in situations where clients express emotional distress, prioritize interventions that address their psychosocial needs to enhance overall well-being and compliance with treatment. A 6-month-old infant is admitted to the pediatric unit with bronchiolitis. The infant's mother, who is a single parent, appears visibly anxious and overwhelmed. She mentions that she has been unable to sleep or eat properly since the infant's symptoms began. The mother also expresses concern about missing work and the potential financial impact. As the nurse, what is the most appropriate initial intervention to support the mother's psychosocial needs? Here are the options. Option 1. Encourage the mother to take a walk outside to clear her mind. Option 2. Provide information about local support groups for single parents. Option 3. Offer to contact a social worker to discuss financial assistance options. Option 4. Suggest the mother take a nap while the infant is being monitored. The correct answer is C. Rationale, correct answer, the third option. Offering to contact a social worker to discuss financial assistance options addresses the mother's immediate concern about the financial impact of her child's illness. This intervention directly targets her expressed anxiety about missing work and potential financial strain, which can help alleviate some of her stress. By addressing her financial worries, the nurse can help the mother focus more on her child's care and her own well-being. This approach demonstrates empathy and practical support, which are crucial in psychosocial care. Distractor rationales? A. The first option. While taking a walk might help clear her mind, it does not address the mother's specific concerns about finances and work. B. The second option. Providing information about support groups is beneficial, but it does not immediately address her financial worries. D. The fourth option. Suggesting a nap might help with her fatigue, but it does not tackle her anxiety about financial issues. Clinical tip: when supporting caregivers, prioritize interventions that directly address their expressed concerns to effectively reduce stress and improve their ability to care for their loved ones. A 35-year-old male client with Hodgkin lymphoma is undergoing chemotherapy treatment in an outpatient oncology clinic. The nurse is preparing to administer chemotherapy, but notices that the client is not wearing a medical mask. Considering infection control protocols, what is the nurse's best action? Here are the options. Option 1. Provide the client with a mask and instruct him to wear it during the visit. Option 2. Proceed with chemotherapy administration as scheduled. Option 3. Ask the client to wait outside the clinic until a mask is available. Option 4. Encourage the client to maintain social distancing from other patients. The correct answer is A. Rationale. Correct answer, the first option. Providing the client with a mask and instructing him to wear it is crucial in minimizing the risk of infection, especially in an immunocompromised patient, such as one undergoing chemotherapy for Hodgkin lymphoma. Chemotherapy weakens the immune system, increasing susceptibility to infections. So, following strict infection control measures is essential to protect the client from potential pathogens in the healthcare setting. Distractor rationales. B. The second option, proceeding with chemotherapy without addressing infection control measures, fails to protect the immunocompromised client from potential airborne pathogens. C. The third option, asking the client to wait outside without offering a mask, delays care unnecessarily and does not address the immediate need for infection control. D. The fourth option, while social distancing is important, it does not replace the need for wearing a mask, particularly in a healthcare setting where exposure risks are higher. Clinical tip: always provide immunocompromised clients with a mask upon entering healthcare settings to reduce infection risks. Proper PPE use is crucial in protecting vulnerable populations from healthcare-associated infections. A worried parent rushes their toddler into the clinic after noticing that the child has ingested an unknown quantity of an over-the-counter cold medication. What is the nurse's first action? Here are the options. Option 1. Induce vomiting immediately. Option 2. Assess the child's vital signs. Option 3. Administer activated charcoal. Option 4. Call the Poison Control Center. The correct answer is B. Rationale, correct answer, the second option. Assess the child's vital signs to evaluate their current condition and determine the urgency of the situation. Distractor rationales. A. The first option. Inducing vomiting is not recommended without guidance as it may cause more harm. C. The third option. Administering activated charcoal is beneficial, but should be done after assessing the child's stability. D. The fourth option. While contacting poison control is important, assessment of the child's status takes precedence. Clinical tip. In pediatric emergencies, always assess the child's current condition before implementing interventions. Memory aid, vitals first, action second. A 68-year-old client with chronic lymphocytic leukemia is admitted to the hospital for chemotherapy. The nurse is preparing to administer the first dose of chemotherapy. Which action should the nurse prioritize to ensure the client's safety during this treatment? Here are the options. Option 1. Verify the client's identity using 2 identifiers. Option 2. Ensure the client is wearing a medical alert bracelet. Option 3. Review the client's dietary restrictions. Option 4. Check the client's vital signs before administration. Option 4. The correct answer is A. Rationale. Correct answer, the first option. Verifying the client's identity using 2 identifiers is a critical safety step to ensure that the correct medication is administered to the correct client. This practice helps prevent medication errors, which are particularly crucial in chemotherapy due to the high-risk nature of these drugs. Ensuring accurate identification aligns with the Joint Commission's national patient safety goals and is a fundamental aspect of safe and effective care. Distractor rationales. B. The second option. While wearing a medical alert bracelet is important, it does not directly impact the immediate safety of chemotherapy administration. C. The third option. Reviewing dietary restrictions is important for overall care, but is not directly related to the safe administration of chemotherapy. D. The fourth option. Checking vital signs is important, but not the priority action for ensuring the correct client receives the chemotherapy. Clinical tip. Always use 2 identifiers, such as the client's name and date of birth, to verify identity before administering medications, especially high-risk ones like chemotherapy. An adult client with a history of major depressive disorder, hypertension, and type 2 diabetes mellitus presents with recent medication adjustments, including sertraline and lisinopril. The client reports new-onset fatigue and mild edema. Labs reveal HbA1c of 8.5% and BP readings have trended upwards over the past month. The client is 2 weeks post-cardiac catheterization with no acute complications. Which lifestyle change will most reduce cardiovascular risk? Here are the options. Option 1. Increase adherence to prescribed antihypertensive medications. Option 2. Incorporate a low-sodium diet to reduce fluid retention. Option 3. Engage in a daily exercise routine tailored to physical limits. Option 4. Adopt a Mediterranean diet rich in fruits, vegetables, and healthy fats. The correct answer is 4. Rationale. Correct answer 4. Step-by-step clinical reasoning. 1. First, identify that the client has multiple cardiovascular risk factors, including hypertension, diabetes, and recent fatigue and edema, which may suggest worsening cardiac function. 2. Next, consider that dietary patterns have a profound effect on cardiovascular health, with the Mediterranean diet being specifically associated with significant risk reduction in cardiovascular disease. 3. Priority setting involves addressing modifiable risk factors that have the largest impact on overall cardiovascular health. 4. Evidence-based practice indicates that the Mediterranean diet, rich in omega-3 fatty acids, antioxidants, and fiber, can improve lipid profiles, reduce blood pressure, and lower inflammation, which are critical in managing this client's condition. 5. This leads to the conclusion that adopting a Mediterranean diet provides the most comprehensive approach to reducing cardiovascular risk while supporting the client's mental health and overall well-being. Estruck et al., 2018. Distractor rationales. 1. While increasing adherence to antihypertensive medication is important, it does not directly address dietary influences on cardiovascular health. The client may still experience cardiovascular risks from poor dietary habits despite medication use. Additionally, giving dietary guidance can provide non-pharmacologic means of blood pressure control. Sachs et al., 2001. 2. A low-sodium diet can reduce fluid retention and blood pressure, but it does not address the broader dietary habits that contribute to cardiovascular risk. While sodium reduction is beneficial, it is not as comprehensive as a dietary pattern change, such as adopting the Mediterranean diet, which encompasses multiple beneficial components. Appel et al., 1997. 3. Engaging in regular exercise is beneficial for cardiovascular health. However, the client may have limitations due to recent fatigue and mild edema, requiring tailored physical activity. The diet change provides a safer, more immediate impact with broader cardiovascular benefits, while physical activity levels are being optimized. AHA 2019. Clinical tip. Clinical Pearl. The Mediterranean diet is supported by extensive evidence for reducing cardiovascular risk and is often more sustainable and impactful than single dietary changes or medication increases. Combining lifestyle changes with pharmacotherapy optimizes outcomes for patients with complex comorbidities. A 17-year-old male visits the clinic for a routine sports physical exam. During the visit, the nurse discusses the importance of self-examination through early detection of testicular cancer. Which statement by the nurse is most appropriate to include in the teaching? Here are the options. Option 1. Perform the self-exam immediately after vigorous exercise. Option 2. The best time for a self-exam is during a hot shower or bath. Option 3. Testicular cancer is not a concern until after the age of 30. Option 4. Self-exams should be done every 6 months. The correct answer is B. Rationale. Correct answer, the second option. Performing a testicular self-exam during a warm shower or bath is recommended because the heat helps relax the scrotal skin, making it easier to feel for any unusual lumps or changes. Early detection of testicular cancer significantly improves the chances of successful treatment. This approach aligns with preventive health measures and empowers adolescents to take an active role in their health maintenance. Distractor rationales. A. The first option. Performing the self-exam after vigorous exercise is not advisable, as the scrotum might be tense and difficult to examine accurately. C. The third option. Testicular cancer is most common in younger men between the ages of 15 and 35, making early detection crucial in this age group. D. The fourth option. Monthly self-examinations are recommended, not every 6 months, to increase the likelihood of early detection. Clinical tip. Teach young males to perform monthly testicular self-exams in a warm environment to detect abnormalities early. Early detection is key to effective management of testicular cancer. A 65-year-old client with a history of basal cell carcinoma is admitted to the hospital for surgical excision of a lesion on the nose. During the preoperative assessment, the nurse notes that the client is anxious about the procedure and expresses concern about the risk of infection. Which nursing intervention is most appropriate to address the client's concerns about infection control and ensure a safe care environment? Here are the options. Option 1. Explain the importance of hand hygiene and ensure all staff adhere to it. Option 2. Provide the client with a pamphlet on skin cancer prevention. Option 3. Reassure the client that antibiotics will be administered post-operatively. Option 4. Encourage the client to discuss their anxiety with the surgeon. The correct answer is A. Rationale. Correct answer, the first option. Explaining the importance of hand hygiene and ensuring all staff adhere to it is crucial in preventing infections, especially in surgical settings. This intervention directly addresses the client's concern about infection control by involving them in the process and reinforcing the hospital's commitment to maintaining a sterile environment. Hand hygiene is a fundamental practice in infection prevention, and educating the client empowers them to be active participants in their care. This approach aligns with the principles of creating a safe and effective care environment. Distractor rationales. B. The second option. Providing a pamphlet on skin cancer prevention does not directly address the client's immediate concern about infection control during their hospital stay. C. The third option. While antibiotics may be part of post-operative care, reassurance about their use does not address the client's concern about infection prevention during the procedure itself. D. The fourth option. Encouraging the client to discuss anxiety with the surgeon is important for emotional support, but does not specifically address infection control concerns. Clinical tip: involving clients in infection control practices, such as hand hygiene, not only reassures them, but also promotes a culture of safety and accountability in healthcare settings. A 35-year-old client with newly diagnosed aplastic anemia is admitted to the hospital for treatment. The client expresses feelings of isolation and anxiety about their condition. Which nursing intervention should the nurse prioritize to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to join a support group for individuals with chronic illnesses. Option 2. Provide detailed information about the treatment plan and potential side effects. Option 3. Facilitate a meeting with a spiritual advisor to discuss existential concerns. Option 4. Arrange for a family meeting to discuss the client's care and emotional support. The correct answer is A. Rationale. Correct answer, the first option. Encouraging the client to join a support group for individuals with chronic illnesses can significantly help reduce feelings of isolation and provide emotional support. Support groups offer a platform for sharing experiences and coping strategies, which can alleviate anxiety and promote a sense of community. This intervention directly addresses the client's expressed feelings of isolation and anxiety, which are common psychosocial concerns in chronic conditions like aplastic anemia. Distractor rationales. B. The second option. While providing information about the treatment plan is important, it primarily addresses the client's informational needs rather than their psychosocial concerns. C. The third option. Meeting with a spiritual advisor may be beneficial for some clients, but it does not directly address the client's specific feelings of isolation and anxiety. D. The fourth option. Arranging a family meeting can enhance family support, but may not directly address the client's personal feelings of isolation and anxiety. Clinical tip: encouraging participation in support groups can enhance coping mechanisms and provide emotional support, which is crucial for clients dealing with chronic illnesses. A 16-year-old client is admitted to the hospital with acute appendicitis and is scheduled for an appendectomy. The client appears anxious and is frequently asking the nurse about the surgery and recovery process. Which nursing intervention is most appropriate to address the client's anxiety? Here are the options. Option 1. Provide detailed information about the surgical procedure and recovery process. Option 2. Encourage the client to express feelings and concerns about the surgery. Option 3. Assure the client that the surgery is routine and there is nothing to worry about. Option 4. Distract the client with activities such as watching TV or playing games. The correct answer is B. Rationale. Correct answer. The second option, encouraging the client to express feelings and concerns about the surgery, is the most appropriate intervention to address anxiety. This approach allows the client to verbalize fears and receive emotional support, which can help reduce anxiety. It also provides an opportunity for the nurse to assess the client's understanding and provide reassurance or clarification as needed. Active listening and empathy are crucial components of psychosocial care, especially in adolescents who may be experiencing heightened emotions. Distractor rationales. A. The first option. While providing information is important, it may not directly address the client's emotional needs or anxiety. C. The third option. Simply assuring the client that there is nothing to worry about may dismiss their feelings and does not provide an opportunity for them to express their concerns. D. The fourth option. Distraction may temporarily alleviate anxiety, but does not address the underlying emotional concerns or provide an opportunity for therapeutic communication. Clinical tip. When addressing anxiety in adolescents, it's important to create a safe space for them to express their feelings and concerns. Active listening and empathy can significantly reduce anxiety and build trust. A 28-year-old client with a history of stimulant use disorder is admitted to the emergency department with agitation, tachycardia, and hypertension. The client is pacing and appears anxious. Which of the following is the most appropriate initial nursing intervention to ensure the client's safety? Here are the options. Option 1. Administer a benzodiazepine as prescribed. Option 2. Place the client in physical restraints. Option 3. Provide a calm and quiet environment. Option 4. Initiate a one-to-one observation. The correct answer is C. Rationale. Correct answer, the third option. Providing a calm and quiet environment is the most appropriate initial intervention to reduce stimulation and anxiety in a client with stimulant use disorder. This approach helps to prevent escalation of agitation and potential harm to the client or others. It is a non-invasive measure that prioritizes the client's safety and comfort, aligning with the principles of a safe and effective care environment. Distractor rationales. A. The first option. While administering a benzodiazepine may be appropriate, it is not the initial intervention. The environment should be controlled first. B. The second option. Physical restraints should be a last resort due to the risk of injury and should only be used if the client poses an immediate threat. D. The fourth option. One-to-one observation may be necessary if the client's agitation escalates, but initially, modifying the environment is less intrusive. Clinical tip. In cases of stimulant intoxication, reducing environmental stimuli can significantly help in managing agitation and preventing escalation. A 55-year-old client with polycythemia vera is admitted to the hospital for phlebotomy. During the assessment, the client expresses feelings of frustration and isolation due to frequent hospital visits and lifestyle restrictions. The client also mentions difficulty sleeping and a lack of interest in previously enjoyed activities. Which nursing intervention should the nurse prioritize to address the client's psychosocial needs? Here are the options. Option 1. Encourage the client to join a support group for individuals with chronic illnesses. Option 2. Discuss the importance of adhering to the treatment regimen to prevent complications. Option 3. Provide education on relaxation techniques to improve sleep quality. Option 4. Refer the client to a mental health professional for further evaluation. The correct answer is A. Rationale. Correct answer, the first option. Encouraging the client to join a support group for individuals with chronic illnesses addresses the client's feelings of isolation and frustration. Support groups provide a platform for sharing experiences and coping strategies, which can enhance emotional well-being and reduce feelings of loneliness. This intervention directly targets the client's expressed psychosocial concerns and promotes social interaction, which is crucial for mental health. Distractor rationales. B. The second option. While discussing treatment adherence is important, it does not directly address the client's psychosocial needs or feelings of isolation. C. The third option. Providing education on relaxation techniques may help with sleep, but it does not address the client's feelings of isolation and frustration. D. The fourth option. Referring to a mental health professional is beneficial, but it may not be the immediate priority compared to fostering peer support. Clinical tip. Support groups can be a valuable resource for clients with chronic conditions, offering emotional support and practical advice from peers who understand their experiences.
All right, that's it for today's question bank session. At the end of each practice, you'll receive your score along with detailed rationales and a full performance analysis. Be sure to check out Exam ASAP, our AI-powered platform with over 5,000 peer-reviewed NCLEX questions and in-depth rationales. It also includes adaptive testing, audio rationales, daily updates, and 24/7 AI tutor support, all designed to help you pass the NCLEX on your first try. For the ultimate NCLEX content review, visit yournursingspace.com and explore our NCLEX Ultimate Guides and more. If you found this video helpful, don't forget to like, comment, and subscribe. It really supports the channel. Keep up the great work, and we'll see you in the next lecture.